Hi, everybody. This is Dr. Eliana Aaron, Director of EMA Care. I hope everyone is staying safe and taking care of themselves. Today, we're going to talk about some of the questions that people have asked over the last week or so. I'm going to answer some of those questions, and I'm also going to talk about the situation in Israel. So, question number one, if a person travels outside of the tri-state area on a plane versus a car, should they stay away from a local minyan? So right now, depending on the state that you're going to visit, compared to the state that you're coming from, there are rules in place between states where the states that are currently having very big outbreaks like Florida, Texas, California, and obviously quite a lot of other states, a lot of the states that are now past their first wave or in a sort of lull, like the tri-state area, well, there is now a 2-week quarantine mandated for those states. The enforcement of this is negligible. It doesn't mean you shouldn't do it, but not a good thing not to. But the concept here is that when you go from a place that has a very large amount of new cases compared to a place that has a lower level of cases, you could be potentially exposing people to a higher risk just by being there in the minyan. So I think it's very important when you're making decisions about davening to consider the risk that you might be giving to other people. Whether that shul is very careful about everyone wearing masks and social distancing. If you're coming from a real hotspot, I do recommend that you do not go to shul. Traveling on a plane or not traveling on a plane is less relevant than where you're going and where you're coming from. So you have to make a good judgment, unless, of course, the law dictates that you have to do a 2-week quarantine, in which case you're not going to shul. So use good judgment. So basically, part of that question is also, is the airport considered a risk? And it is considered a moderate risk. Historically, in pandemics or epidemics, airplanes and airports that have large amounts of people coming in from different ports around the world has been a source of outbreak. And that, of course, that source of outbreak has then gone to whichever destinations the airplanes are coming from, and going to, sorry. So understand that that's the history. What we are seeing now is airplanes no longer have recycled air. The air exchange in airplanes with the HEPA filters in place and with the system they currently have is about I've heard 10 or 11 seconds, there's a full exchange of air in the airplane, which is really great and has made traveling on airplanes safer. It's still very crowded, and if somebody on board has coronavirus, and especially if they are not properly covering up with a mask, and or if you're not protecting yourself with good hygiene, if the airplane is extremely crowded, it's still going to be a risk. So a moderate risk at least, even with the good air exchange. So airports is a different story. Airports are, again, traditionally a problem. Part of the problem in airports is that they get very crowded. Part of the problem is that you wait in line and, you can't wait 2 meters away because then people are going to cut in. It's a reality that we just have to deal with in airplanes and airports. So there is a lot of crowding, and social distancing is extremely hard to keep. So airports are a problem. The airflow inside an airport, there's usually not that many open windows. Usually it's closed windows with internal air circulation with air conditioning systems and vents, which are known to be not great for this disease. Okay, we know that air conditioning is not a good place. The virus seems to really like air conditioning. So my suggestion is, look, we have to travel, at some point in everyone's life in the next year to 2 years, however long it takes for us to all be vaccinated. It will take us, during that period of time, we are going to get on an airplane, at least a good part of us. Life goes on. We have to visit people. A lot of us are coming on gap year, sending our kids. We don't know how much tourism there's going to be yet. Hopefully that'll get settled. People are moving to Israel. People are traveling back and forth to work. There's a lot of reasons why people travel internationally besides just going on vacation. So it's just part of life nowadays. So if you have to travel, then you need to make sure that you are taking care of yourself as much as possible. You can't always control the crowds, although frankly, it's not responsible for the airlines to be crowded, and it is important to let people in social media know, to put pressure on them to reduce the packed in, economy class situation that there is. If you travel in a premium class, that's a little bit better because there's a little more space around you. And obviously it's a little bit better for social distancing. Wearing a mask the entire flight is really important. Some of the areas of cross contact are going to be your airline, the seat tray, the lock, the remote control, the buttons to move back your seat, bathroom door handles and locks and flushes and faucets. Any shared spaces at all become problematic. So I personally suggest that people have antimicrobial wipes when they get onto an airplane, and they wipe down their area very well, including their screen, their open and closed tray table, the buttons, the remote control, and any other spaces that are potentially shared, especially with your neighbor. Seatbelts, by the way. People, how often do airplanes clean seatbelts? I don't know either. So, but we have to use them. We have to unbuckle and buckle. We go to the bathroom. Anytime you get up from your seat on an airplane, I would have a pair of gloves on. So some of the things you need to bring on an airplane besides your mask and spare mask in case something happens. I know of somebody who mid-flight, the rubber band around the ear broke off and their mask didn't fit and they didn't have a spare. And obviously that's a big problem. Always have a spare mask. They're not terribly expensive. Antimicrobial wipes, gloves that fit you. And, you need to have that. I strongly suggest that, again, you get up, you wear your gloves, you wear your gloves to the bathroom. You could use your gloves when you are in the bathroom. It's not a big deal because you're going to throw them out anyway. You can even wash your gloves and your hands after going to the bathroom, and then use alcohol gel when you are finished with the bathroom so that even though you touch the door, you can sanitize your hands. So you could do that. If you don't have gloves, you could just use a lot of alcohol gel. Again, because of the restrictions that we have, we can't bring a big bottle of alcohol gel. You can't bring your big bottle of alcohol liquid. Have a couple of the small bottles of alcohol gel with you so that you feel you could be generous with it. As far as health tips for getting on an airplane nowadays, we don't want people to take their masks off, and obviously eating is a very high-risk activity because when we eat, our mask has to be off. When we drink, our mask has to be off. People cough, people talk, things are spritzing. Okay, that's part of life. So in as much as possible, try to eat and drink before your flight. If you're going on an international flight, I do recommend that you are well hydrated for at least 2 days before you get on the airplane. I'd rather you go to the bathroom a lot on the airplane than to end up dehydrated, especially in the summer. But anyway, even in the winter, the air on an airplane is very low humidity and it does dry out your system. So very important to hydrate very well a couple days before your flight. If you need to drink on the plane, that's fine. Try to tilt your head away from other people. Okay, so if you're at the aisle, it's a little more difficult. The aisle is a more challenging seat. Remember that all the flight attendants are fully, dressed in protective gear. But when you have to drink on a plane, if you're in the aisle and someone next to you is also drinking or eating, I would tilt away from them. So at least as long as there are no people like walking right by you, at least you're not facing their stream of droplets as much. And if you're by the window, you could tilt towards the window and away from your neighbor. So I do suggest that when you land, I do suggest as well that you stay hydrated, at a very high level for at least 2 days after you get back to replenish what you might have lost. So in as much as possible, try to avoid eating, if you can, and drinking on airplanes, unless you have to. And if you have to, it's okay. Just try to keep as much of the hygiene aspect as possible. Wash your hands before, wash your hands after. Try to point a little bit away. It's very difficult in economy. Try to point a little away from people. These things do matter. I also think that it's really important for people to bear in mind that, you don't have to feel bad if you do have to eat or drink. I think people are feeling a lot of guilt about decisions that they have to make. I'm just telling you what would be safer if you're going from, LA to New York, besides needing the 2-week quarantine nowadays, you are on a shorter flight. So not eating or drinking for a few hours is usually not such a big deal. Going on an international flight is definitely more challenging. So I think that's very important. And again, if you do eat or drink, make sure that if you're taking a break from drinking, like you have a few sips, then you put it down, put your mask back on, okay? And if it's possible to eat, I'm not telling you to eat like a pig so that you're choking, but eat in a focused way, finish eating as quickly as is safe and possible, and put your mask back on. Just minimize your exposure. Another thing you could do is potentially not eat at the same time as the person next to you. So if the person next to you is eating, save your sandwich and eat when that person is done eating and their mask is back on, hopefully. And that way, at least you know that your germs are not all going into each other's mouths at the same time. It's the best we can do, trying to make the most of a difficult situation. Another question, what are the common symptoms here in Israel? Israel is having exactly the same disease as everywhere else. So all of the regular symptoms that we've discussed in our WhatsApp group. So obviously the most obvious one is fever, coughing, respiratory difficulty. All of the viral symptoms, frankly, are related to coronavirus at this point. One other thing that's very specific is a loss of taste or smell or both. It's not terribly specific because a lot of viruses can do that, but it is something that we are seeing around the world, and it is considered a symptom. But people have had diarrhea, people have had body aches, lethargy, all kinds of other symptoms. All those symptoms are happening here too. There's no difference. Okay, outdoor pools. I did water aerobics in someone's outdoor pool, like one of the above ground pools last year. It's a very small pool, can I do that? So first of all, we have the new restrictions, which we're going to discuss in a minute. But more than that, you need to realize, I did not answer this question for a few weeks because it was too early. the pool is considered, considering that it's an outdoor activity, it is a moderate risk. And a lot of outdoor activities are less of a moderate risk, so you need to realize that. When you're in a small pool where it's hard to socially distance and you're exercising and therefore breathing more heavily, it is a higher risk situation. If you're the only one in the pool, or if there's two people in the pool on opposite ends, then that's a reasonable risk. If it's a group and everyone has 2 feet of space or 3 feet of space, it's really, really not a good idea. It's just not. Chlorine, there is no proof that chlorine in a water diluted to that extent has any impact on this disease. And what we do know is that the disease seems to like spreading between people. If you're exercising, then you're breathing more heavily, then you're expelling your droplets further. You can't wear a mask in the pool. So there are people who've gone swimming. Most people that I know who have gone swimming and feel comfortable have been swimming in large pools with lots of space between people. So that's an important distinction. A small pool is a higher risk. If someone attends another minyan, indoor or outdoor, should they be allowed to attend a local minyan? So this is a little bit unclear. If you are going from an outdoor minyan to an outdoor minyan and everyone is keeping distance, then it shouldn't make a difference which minyan you join. Likewise, if you go to an outdoor minyan and you decide you want to join an indoor minyan, and of course the indoor minyanim are going to be limited when these new regulations take place, then that's not such a problem because the outdoor minyan is a lower risk than the indoor minyan by far. Okay, assuming that people keep to the restrictions, including not standing next to each other. What I have observed here in my town, where there have been outdoor minyanim for 3.5 months or so, almost, maybe almost 4 months, we've had outdoor minyanim, and during that time, I have noticed that there are people who just don't wear a mask at all. So there are some minyanim where most people wear masks, some minyanim where very few people wear masks. There are some minyanim where people are clustering together with or without masks, sitting next to each other outside, like we're in shul, but we're not. So you need to realize that there's a lot of variation. So basically, what this means is that if you keep to the regulations and you're outside and you're 2 meters away from people and you're wearing a mask, then that's wonderful. With the weather getting hotter, obviously we are now entering the second week of July. With the weather getting hotter, it's going to be harder to have outdoor minyanim. My suggestion is to have early minyan before it gets too hot. It's not a good idea for people to be outside, first of all, sweating in their masks, which makes the mask invalid. Being exposed to heat and potentially dehydrating or getting a sunburn, also a bad idea, and certainly that is extremely dangerous. I just think that there are better ways to do it. So an earlier minyan when it's still relatively temperate outside is a better idea. And likewise for mincha, my suggestion is to make it as late in the afternoon as possible so that the sun's already starting to go down and it's a little bit cooler past the peak of the heat of the day. Now, if someone is attending indoor minyan, again, I think the issue is not switching minyanim and trying out different minyanim because a lot of people are a little bit minyan hopping to find the safest minyan. I think the most important thing is that minyanim have to establish some enforcement for their minyan. There are some shuls that are doing a fantastic job. This Shabbat, when we were still allowed to have 50 people davening together, extra people who had not signed up in advance showed up, and the gabbai, who was managing the minyan, told those people you didn't sign up and you can't be here because it's exceeding the 50 people. And that is appropriate because the Gabai's job is to make the minyan happen and to keep things moving, but also to be a little bit of an enforcer to decide who gets an aliyah, and also to keep the minyan organized. And part of organizing a minyan during the coronavirus is to keep it safe. There are minyanim where when people start wearing their masks here and not covering their nose, or here, or maybe not even showing up with a mask, that they will stop the davening and say, will the people who are not covering their nose or their mouth, please put your mask on? Or will the people who are not wearing masks please leave the minyan so we can continue? And what I've heard from people is that when the minyan is stopped for this reason, it does not happen again. People realize, wow, I don't want people staring at me and with my mask not on. I'm going to make sure it stays on. And people end up self-correcting. And that's a very positive message. So I do believe that minyanim can be safer or not safer. I think minyanim in rooms that don't have windows and airflow is a problem. And there has to be enough of it. The larger room is better because, there's just more airflow. So I think that's more of the essential point. Look, minyanim have been, I'm going to say, implicated as a high risk scenario where we're having large spreading events. I'm not going to say super spreading, but large spreading events. And the reason why is because all the reasons that I discussed in my previous video, which is basically people are davening, they're singing, their voice is projecting, which spritzes respiratory droplets much further. In many minyanim, the chazan does not have a mask, and that might be okay if he is completely isolated from other people and there are barriers between him and the person who's next to him, etc. But people are not keeping to the rules as they should be. You can't put 50 people in a small room. Some of the shuls that I've seen are too small for 50 people. You cannot possibly separate enough. And what they're saying is, well, we'll put one person on each bench, but the person in front of you is 3 feet away, not 6 feet away, or 1 meter away instead of 2 meters away, because the benches are all crowded together. So we have to keep that in mind as well. So I think that minyanim need to be safer so they don't become super spreader events. And we know what the consequences are if we don't do that, which is that the shuls are going to close again. It's happened. No one wants it to happen again. We've heard that Rav Schechter has said that this year on Rosh Hashanah, there needs to be a much shorter service so people are less exposed to each other. I think that I'm not talking obviously from a religious point of view. I'm talking from a medical point of view. I'm not a rabbi. But from a medical point of view, minimizing the in-person contact that you have with other people is absolutely an essential part of breaking the epidemiological chain. You want to have shorter contacts. You want to have less contacts. You want to make sure that people are covering up. You want to make sure that there's plenty of fresh air flow. The other thing I'm concerned with Rosh Hashanah, people are starting to ask, I know it's a couple months away, shofar blowing is a problem because the process of shofar blowing, for those of you, I grew up with a father who blows a shofar. The process of blowing the shofar is that you are basically, I'm not going to say spitting, but you're doing this, like blowing a strawberry, for those of you who understand what that is, into the shofar, and that spritzes the respiratory droplets very far. And of course, you can't blow a shofar quietly because you need a certain amount of pressure in the lip movement in order to even make any kind of a sound. That's the way the shofar works. So I believe that shofars, if it's possible, and again, I'm not a rabbi, but if possible, shofar should be blown outside with people far away from the shofar, but able to hear, obviously. So if you have a large open space, you can have the minimal number of kolot that is needed, 30 or whatever it is, and that the person blowing the shofar is distanced from the congregants, because obviously he can't have a mask on, and minimizing the contact in shul, eliminating prayers that are less urgent to say in a public setting. If there are things you could say at home, that's better. Trying to reduce the amount of time that people are in the same space, because we can't have 6-7 hour prayers on the high holidays this year. I think it's incredibly dangerous. And even if the highest people stay at home, most people who go to Minyan on a regular basis are going to want to go to shul, and you need to have a safe option for them. So I think that reducing shul to a minimum, reducing the singing, which also projects droplets, to a minimum, and trying to focus on concentrating on the essential parts of the tefillah, which is Shemona Esrei, Musaf, that kind of thing, Kriyas Torah, and finding a way for people to be able to supplement at home. It's not realistic for people to be in outdoor minyanim unless they start super early, because it's going to be really hot. I mean, September is still the summer here in Israel. So those are the questions for today. This is long enough. And what we're going to do is discuss how the new regulations are going to be impacting. Probably on the WhatsApp group, we'll discuss it. Okay? I hope everyone stays safe. Take care.